Okay, this is book review of Starch Solution, Dr. McDougall. This is part 3. We'll start out talking just a little bit about some of the things Dr. McDougall mentioned about the epidemiology in more detail. He starts out by saying, well, vegans are better looking than other people. The reason is they got better blood supply to their skin. They get more of a look of glow of vitality, if you will, and they're skinnier. And he talks about how health is attractive. And the reason health is attractive is because we have to pick somebody to mate with, and we want to mate with a person who's healthy because it's more likely that the children will be healthy. It's more likely that they'll survive to help take care of the child. Next thing he says, most people think that starches are bad, that they turn to sugar and the sugar turns to fat. But if that were true, how come 1.7 billion rice-eating Asians are skinny? Why don't they get skinnier and healthier when they move to the USA and they start eating more meat? Instead, they get fatter and sicker. If potatoes and another starch were fattening, then how come the potato eaters of Peru are so trim and so strong? McDougall used to lead these adventure trips to Peru. If the people of Papua New Guinea, central Papua New Guinea, they eat almost entirely sweet potatoes, about 93% of their calories. But they don't have any need for Weight Watchers. They're trim and strong. The same starch-based populations have very low rates of diabetes, arthritis, gallstones, constipation, multiple sclerosis, heart disease, and cancer, breast cancer, prostate cancer, colon cancer, because those are like diet-related cancers. Fat makes people fat. The fat you eat is the fat you wear. When you eat fat, only 3% of the calories are lost in the process of transferring it from your intestine to your cells. So what that means is the fat that you eat through your mouth goes into your gut. Only 3% of calories, that much energy is used to take that piece of fat and store it in your fat cells. And there's so little change involved that if you do a biopsy of their fat, biopsy of their belly, for example, the fat you get out of the biopsy will be the same as what they ate. So if a person eats a lot of sat fat, the biopsy shows up sat fat. Same for omega-6, omega-3, or trans fat. The other thing he says is moderation is impossible for passionate people. And that goes back along the lines of, and Dr. McDougall has said this before, you don't tell an alcoholic they can drink on the weekends. You don't tell a cigarette smoker they can smoke on the weekends. They have to quit smoking. They have to quit drinking. And the other thing, too, is, it's not easy to have one piece of pizza. It's probably a good idea you just don't eat pizza anymore. Like the Lay's potato chip junk food where they put all these flavorants on it. They say, I bet you can't just have one. And most people can't. So it's good to just not go down that path. Okay, here is some data from a paper written by Roy Swank. Roy Swank was a neurologist who started out working in Canada. He had gone through all the data on Norway, whereby the person eating more dairy had more multiple sclerosis, more of an autoimmune disease. He did research on animals, Roy Swank did, where he would feed them high-fat diets. And he noticed with the high-fat diets, you would get something called rouleau formation, where the red blood cells stick together and they stack up like stacks of coins. Rouleau means stack of coins in French. You would also get just these blobs of red blood cells all stuck together, and that's called blood sludge. And it's thought that prandial means eating. So immediately postprandial, after eating, the chylomicrons would stick the red blood cells together. And that ends up being a big deal because a red blood cell already is bigger than a capillary. Typical red blood cell is about 7 microns in diameter. Typical capillary is about 5 microns. So if you're sticking these red blood cells together, you got this bulky, multi-level submarine sandwich, so to speak, trying to push through a capillary. Pressure has to go up to pump that through. So it's going to cause hypertension. Also, it leads to decreased oxygen reaching the tissues. In the ballpark, the high-fat diet is causing about 15 to 20% decreased oxygenation of the tissues. And the tissues can handle that 15 to 20% typically, but you start superimposing things on that, like more sodium. There's a vasoconstrictor. If you got leaky gut, you're going to have more postprandial tendency to clotting. If you're stressed out, your blood's going to be a little more prothrombotic. So these are going to make red blood cells stick together more. And it's going to be harder and harder to get those red cells push through the capillaries without increasing blood pressure. Roy Swank tested these things in animals, let's say after butterfat. After one experiment in hamsters, he got a 30% drop in O2 delivered to the tissues in the brain on one of his studies. You can look at red blood cells for these types of experience in the cheek pouch of a hamster. You can look at it in the eyes in humans. Meyer Friedman and Ray Rosenman did that study on humans. You can look under the tongue. sublingually in humans. And Dr. McDougall points out safflower oil causes just as much sludging as sat fat. So both sat fat and the omega-6 fats are known to cause this blood sludging. So the omega-6 fats are all the typical cooking oils. This picture actually comes from the idea from, like, you know, Dr. Klaper talked about this. The movie Game Changers had a picture of this. Here's normal blood in a test tube. The red blood cells sediment to the bottom. They contain iron. That's your hematocrit. Then you have the little white thing in the center. That's called the buffy coat where the white blood cells are. Then you have the plasma, which normally should be translucent. You should be able to see through it a little bit. When you eat a high-fat meal, you get all this fat debris, and it becomes relatively opaque. You can't see through it. So you have a macroscopic visible change in the blood when you eat a high-fat meal. And then, of course, like from the Swank studies and related ones, you have major physiologic changes as well. And by the way, I learned about this research from Dr. McDougall. It isn't in the same chapter. I'm not going to go exactly chapter by chapter. What I'm doing is I'm trying to just show you the key points so you get it. Because once you have a comprehensive understanding of this, then you'll feel solid on it. It'll be easy for you to follow the diet. The reason I don't eat the other foods, and it's super easy for me to follow the diet, is because I consider the other foods basically poisons. I wouldn't eat them unless I was starving. Why would I want to eat something that's bad for my health? Okay, so Peter Quall was a cardiologist in Pennsylvania, and he took a bunch of patients with cardiac angina. That means coronary artery disease related, atherosclerosis, narrowing in the arteries of their heart, who would get chest pain. And that chest pain related to the heart on exertion, dyspnea, it's also called shortness of breath. That's called cardiac angina. Anyways, he checked their blood lipids every 30 minutes after feeding them a high-fat meal with saturated fat, and he noticed they were at peak blood lipids, peak lipemia, from about 4 to 7 hours, and that's when they had their peak episodes of chest pain. And it was a very bold thing to do in the 1950s. There was no cardiac cath. There was no way to put a stent in these patients. But what he did was he showed that the peak blood lipids is the peak episode of chest pain, indicating, you know, probable tissue hypoxia, and that being related to causation of myocardial infarction, a heart attack. Okay, then Ray Rosenman and Meyer Friedman in the 1960s, there was a big push. Everybody sort of was coming to agreement that saturated fat is bad in the 1950s, and the work of Ansel Keys supported that. Then there was the idea, well, the omega-6 cooking fats are going to be better. So this experiment was tried with those omega-6 cooking fats, and that's the red line here, and one can see that it caused an even more prolonged blood sludging of the red blood cells, which is going to decrease tissue oxygenation. In fact, the workers in the lab were pissed off because they would start at 8 o'clock in the morning, and these patients were still hyperlipidemic into the evening, so, you know, they wanted to go home. So yeah, the omega-6 cooking oils are even worse. Here's a quote by Dr. McDougall. When safflower oil is used, the sludging of blood was worse, and it lasted longer than with sat fat. Okay, here's showing the idea that the fat causes the red blood cells to stick together. So again, red blood cells bigger than a capillary, about 7 microns. Capillary is about 5 microns. The red blood cell, because it's bigger, has to fold back on itself a little bit. That's an important point. The red blood cell has to be deformable to pass through the capillary. But when you have a bridging molecule, that's something that sticks red blood cells together. Now you're pushing almost like a submarine sandwich through this capillary, so you're going to need higher pressure to do that. Okay. So here is showing a graph of LDL cholesterol, low-density lipoprotein, LDL, versus viscosity. Viscosity just means thickness, the thickness of the blood. The higher the LDL cholesterol, the more higher the blood viscosity, the thicker the blood is. And the important point I'm trying to make here is atherosclerosis is a blood clot, okay? And so the thicker the blood, the more likely it is to clot. The more likely it is to clot, the more likely the person is to have a heart attack. Because what is a heart attack? It's a blood clot blocking the artery of your heart, which thus blocks the amount of oxygen that can get to your heart muscle. Okay, that's a heart attack. And then the next question is, well, why does this all happen? Because red blood cells, they've got a zeta potential around their periphery, a negative charge, okay? And that's good. They both have a negative charge, so they repel each other, which is good. You don't want them to stick together. But there are molecules that are big enough and have a positive charge that can stick those red blood cells together. These molecules that can bridge the red blood cells together, they're called bridging molecules. One of them is IgM antibodies, the type of antibody that goes up with an acute infection. So acute infections increase your risk of clotting. The next one is LDL cholesterol.
the same one we just talked about right here, makes the blood thicker. The other thing, as you can imagine, is the purpose of a blood pressure is to get blood to the top of your brain, the upper cerebral cortex. And so you have to pump that blood against gravity to the top of the brain. Now, if you're pumping regular blood, it's like water. It's relatively easy to pump it to the top of your brain. But if you're pumping thick blood because of the high LDL cholesterol, because of the high dietary fat, you're going to need to pump thick blood like a milkshake under higher pressure to get it up to the top of your brain. Okay, other things will make the blood cells stick together as well. Fibrinogen is a blood clotting protein. And well, guess what? When you're stressed out, fibrinogen goes up and it makes more red blood cells stick together. If you are drinking caffeine or you're sleep deprived, those have the same hormonal elevations as psychological stress. Psychological stress elevates cortisol and the catecholamines, which is adrenaline and noradrenaline, and it makes the blood more thrombotic. You can remember it as being chased by a saber-toothed tiger, chased by a tiger in the dark. And the point is that because the tiger might scratch you, you want your blood to clot a little faster. All right, but we're starting to add things up here. So you've got the psychological stress, increasing fibrinogen in the blood. Well, guess what? If you're sleep deprived, increase fibrinogen in the blood. If you're drinking caffeine, increase fibrinogen in the blood from elevating the same hormones, the stress hormones. And you superimpose on that a high-fat meal, you're sticking red blood cells together, okay? Uric acid will also do it, and that's a byproduct of, let's say, drinking a lot of high fructose corn syrup. If you don't eat enough dietary fiber, most Americans eat hardly any, about like 10 grams a day when they should be eating at least 50. Preferably, Burkett felt we should all be eating 100 grams or more per day. Then what's going to happen is you're going to be predisposed to leaky gut, and you're going to get bacterial endotoxins after eating going into your blood. So eating is prandial. That's postprandial endotoxemia. The relevance is the bacterial endotoxin, typically it's going to be something called LPS, lipopolysaccharide from gram-negative bacteria, LTA, lipoteichoic acid from gram-positive bacteria. These are very strong bridging molecules. They predispose to the blood becoming more likely to clot, prothrombotic. Can you see where this is going? Number one, you got the prothrombotic high fat. Okay, number two, you got prothrombotic postprandial endotoxemia. Number three, stressed out. Number four, drinking caffeine. Number five, sleep deprived. Okay, all of these things are making your blood more likely to be prothrombotic, so they're increasing your risk of having a heart attack. You don't want that. So again, these are some drawings and slides that I'm adding to Dr. Mcdougall's book. What I'm basically doing here is what he said is 100% correct. I'm sort of showing you a little bit more of the molecular biology, okay? So here's the red blood cell stuck together by a bridging molecule. Normally when blood flows, it's laminar. What that means is it has a parabolic blood velocity profile. Here, I'll do it with my hand. You can see it like this. Red blood cells in the center, white blood cells adjacent, and then the plasma on the periphery. So the red blood cells are in the center. The white blood cells are just next to the red blood cells, and then the thumbs are the plasma. And they flow along like that. It's called a parabolic velocity profile of the blood. And this is also called laminar flow. So you want to know that. Laminar flow is parabolic. It's like your hand. That's worth knowing. Okay, so what happens is the blood comes up. And here we are in the neck. You got the internal carotids. My thumb goes up to the brain. The external carotid are my fingers because all the branches goes up to the face. And when the common carotid artery blood comes up, it's going to hit the bifurcation. The external carotid was like my fingers going to the face. The internal carotid was my thumb going straight up through the skull into the brain. So when this blood comes in, it hits the median divider of soft tissues between these branching arteries, and it bounces off of it, causing turbulent flow. Okay, and it'll also cause some retrograde eddy currents. And when you have hypertension, you get an excessive amount of turbulent flow and retrograde eddy currents. And when you have an excessive amount of these, they confuse the arterial lining cells, the endothelial cells in this location, and they will shed their antithrombotic glycocalyx, and they'll start to express prothrombotic molecules. And that'll predispose to forming clots. And remember, atherosclerosis is a blood clot. You need to know that. By the way, my background is I did a fellowship in imaging-guided surgery, vascular interventional radiology at Harvard. I've been studying atherosclerosis for decades, gosh, for over 25 years. So I can tell you that's the first step to really understanding it. Atherosclerosis is a blood clot. I've looked at I don't know how many thousands of CT angiograms. You can't tell a blood clot apart from atherosclerosis because it is a blood clot. Okay, so anyways, it'll form on the far wall away from the median divider. And this is the same thing that happens at bifurcations throughout the body, including the coronary arteries. So what can you do to make this less likely to happen? Well, lower your dietary fat, lower your dietary sodium, so your blood pressure is under control, and you don't get it to hit the median divider so hard, okay, and avoid these prothrombotic things. Okay, eventually pieces of this can break loose and go distally to the brain and cause a stroke. In your heart, pieces can break distally and cause a heart attack in the smaller vessels of the heart. Okay, so Dr. Mcdougall describes the situation as 5 major poisons in animal food. He says excessive animal protein is a poison, and T. Colin Campbell really worked that out. You know, his classic book is the China Study. He also wrote, you know, The Future of Nutrition and Whole. But the key point was the more animal protein you eat, the more predisposed you are to cancer. The more animal protein you eat, it also has an anabolic effect. It almost tells the body now is the time to build, and it actually causes an elevation of blood cholesterol. The more dietary fat you eat, the more likely you are to become fat yourself, the more likely you are to develop insulin resistance, the more likely you are to end up being at least partially immunosuppressed. In separate lectures, I talked about how high dietary fat, and I don't care which one of them it is going to lead to decreased function of the immune system, and it's going to lead to more obesity. Lydia Lynch, the Harvard researcher in immunology, has shown that elevated dietary fat and elevated obesity, which has a spillover effect leading to more fat in the blood, they both suppress immune function. And in her research, they showed increased rate of cancer growth. And that's another reason why I think the ketogenic diet is kind of a foolish choice for a cancer patient, in my opinion, based on a lot of study. You can take a look at Lydia Lynch from Harvard, her research on that same question. Okay, excessive cholesterol. So there's a lot of cholesterol in meat. That's how mammals stabilize their plasma cell membranes, by adding more cholesterol to it, versus plants don't have cholesterol. So you're going to get more cholesterol that way. Now, it's also true the majority of cholesterol in the human body, you can make it in individual cells, and you certainly make lots of it in the liver. But I want to make that point too. You're eating a lot of it as well when you eat animal foods. There's more of methionine as an amino acid in plant foods, about 4 times on average overall more than plant foods. The problem with methionine is 2 problems. Number one, it helps activate mTOR. That's the growth pathway, the anabolic pathway. And you don't want that. It can accelerate the growth of cancer, it's thought. The second thing is methionine is a sulfur-containing amino acid. There's also more cysteine. So methionine and cysteine, the sulfur-containing amino acids, well, those are relatively acidic, and part of their metabolic breakdown is to be made into sulfuric acid. They cause a low-grade metabolic acidosis. And then the process of the kidney excreting the acid from the body, it simultaneously excretes calcium. So you end up with calciuria, more calcium in the urine, and that can lead to a loss of bone mass, which is osteoporosis. That calcium excreted into the urine can also predispose you to kidney stones. So they're both bad things. You don't want that. In addition, I've seen, many thousands of kidneys. You get precipitates, little pieces of calcification in the medullary pyramids, and they're destroying the kidney tubules, the filtration system of your kidney. It's routine for Americans to be in mild kidney failure by the time they're in their 50s. I see that all day long, every day. Okay, salmon, for example, is a typical animal food. 50% fat, 50% protein. That's a terrible food. I would never eat it. 50% fat, 50% protein. And you can just think of that as not that being that far off from other animal foods. And the point Dr. Mcdougall was making in this chapter here from the book Starch Solution is that all animal foods are bad. They're all bad. T. Colin Campbell in his book, like China Study and his other books, The Future of Nutrition and Whole, he shows that if you draw a graph on animal protein, it goes like right through 0. The point being is that any amount you eat is associated with worse health, And he especially, T. Colin Campbell, emphasized the increased cancer risk, okay? But he also emphasized it elevates your cholesterol, presumably because it induces an overall metabolic effect on the body, meaning that it says it's build time and they push more lipids into the blood for replication perhaps. Okay, and you don't want anything that speeds up replication because you're going to be accelerating your aging. You're going to be accelerating the growth of cancer, for example. So Dr. Mcdougall tells a patient, he tells everybody, be 100% vegan. But, that would especially help for like a cancer patient, I would think. Okay, my additions also, and he can kind of allude to this indirectly. The higher the iron, that also can cause activation of mTOR, mammalian target of rapamycin, also called mechanistic target of rapamycin, the nutrient sensing pathway to accelerate growth. Also, animal foods have more leucine. This is stuff that wasn't in the book, but I'm just adding it because, again, I'm trying to show you that Mcdougall is one of the great giants of nutritional medicine. He's like one of the founding fathers of nutritional medicine. And, Doug Lisle, the brilliant psychologist who worked with him, said if he had to make a Mount Rushmore, he would want, Dr. McDougall on there and Dr. Esselstyn, Dr. Colin Campbell, and he'd probably want Dr. Ornish on there. And I think you ought to add Kempner on there. You ought to add Burkitt on there. So we're going to have more faces than the original Mount Rushmore, but you get the drift, okay? So what I'm saying is McDougall figured out this whole comprehensive picture of nutrition, okay? I'm younger than him, 17 years younger than him. I had a little more time to learn some of the newer stuff on what everything he said was correct, but now there's more information available about some of the mechanisms, okay? So we now know that leucine is activating mTOR, and that activation of mTOR is causing problems like methionine did, increasing your risk of cancer progression, okay? And we also know that that anabolic phase seems related to elevating blood cholesterol, which is going to make your blood more prothrombotic, going to increase your risk of having heart attacks and other vascular site occlusions like potentially a stroke. Okay, in general, the plant foods, you win in every way. They're low in fat, almost all of them, except for the high-fat plant foods. I recommend you avoid all the high-fat plant foods, by the way. I think avocados are a bad idea. They spray this terrible thing on them. AP, you know what. E, and then an L. Bad. You want to avoid that. Plant foods have like virtually no cholesterol. They're low in acid. Think about it. Meat is all acid. It's amino acid in the protein and fatty acid in the fat. Whereas plant foods are primarily carbohydrate. Okay, they're not acids. They're much less acidic. And that helps also protect your kidneys. I mean, what does the kidney do? The kidney excretes nitrogen, which only comes from protein. There's no nitrogen in fat. There's no nitrogen in carbohydrate. So the more protein you eat, the more work you're creating for your kidney. So a low protein diet protects the kidney. The kidney also manages acid base and excretes acid. Well, when you eat a low acidity diet, like a plant-based diet, you make life a lot easier for your kidneys. So you protect your kidneys from going into kidney failure. And that's partly what Kempner was doing. Kempner showed you could keep these kidney failure patients alive much longer by putting them on a low acid, low protein diet. He's also putting them on a low sodium diet, which prevents vasoconstriction of the arteries of the kidneys. So he optimizes how well that kidney is perfused to help keep it working. Okay, but everything good in plants. They give you the potassium and the magnesium. Those are the vasodilators, okay? They give you the nitrates, precursors to nitric oxide, vasodilators. They give you the fiber, which helps prevent leaky gut, leaky blood-brain barrier, to improve cognition, to prevent leaky gut autoimmune disease. So it all works. And that's kind of what I was also showing you in my last lecture. McDougall has shown you the entire foundation here to understand why this makes you healthy. And I think the main reason you need this is just for your own individual curiosity, but also so you can stand up to all the nonsense you hear on the internet trying to get you to do things that are rather stupid. Okay? They're always going to be trying to promote all this high-fat food. Nathan Pritikin has said many years ago, the two main categories of diet are high-fat and low-fat. And I can assure you, after extensive study, low-fat is better. And you study it for yourself, you'll see the same thing, but just so you know. All right, let's see if I got any more slides here. Oh, this is kind of a seesaw. And there's a lot of things that are like a seesaw. And you want to spend more of your life in sort of the maintenance phase to the extent that you can. So accelerated aging and death, the meat activating mTOR, the high fat from meat causing increased insulin resistance, that leading to increased insulin levels in the blood, that leading to increased insulin-like growth factor, all of those things, increasing your risk of cancer. And there's the high increased atherosclerosis. They tend to go hand in hand with this activation of mTOR, and that's more prone to causing atherosclerosis. And there's a lot of toxins. I'm not going to get into all that stuff, but the healthier life is get your sunshine, get your exercise, eat your plant foods. So we won't go into all that right now. Here's just basically looking at the diet curves, and it's pretty obvious when you look at these things closely. The standard American diet is a disaster. It's high in fat, especially sat fat, high rate of myocardial infarction, cancer, impotence. The East Asian diets, like the rice-based diet, it's actually a pretty healthy diet. The Okinawans are real healthy. They have more sweet potatoes, but the thing that would get people into trouble would be like in Japan, where they're eating tons of sodium, tons of it, 12, 14 grams a day, and they're also smoking lots of tobacco. But they were still surprisingly healthy despite that. South Asians, like people from India, you know, a lot of them are thin and look real healthy, but they've got more health problems than one would realize. And I think the main reason is they eat too much fried food. They also have some dairy in the form of ghee or yogurt, but the big thing is they fry too much food. So they have surprisingly high amounts of these problems, which just goes to show those omega-6 cooking oils are much worse than is widely realized. And then take a look at the low-fat, low-sodium, vegan, whole food, plant-based diet. They win on every single category. I mean, it's a no-brainer. It's a smart way to go. That's why I do it. That's why I'm interested enough to do this, you know. And like I said too, my wife kind of thinks the whole thing's a joke. Why would you do all this nutrition stuff? You don't make any money doing it. And I'm like, because it's right, because it's good, because I want to, you know, do something good. I feel like my time is well spent when I do all this stuff. And so, like I said, McDougall made the foundation of it. We just went through some of the reasons to support those conclusions. I hope that was helpful.